Welcome to Logical Ayurveda. Today we are going to deal about an interesting topic called how to treat knee pain or Sandhigata Vata. Treating knee pain or any other joint pain is one of the best arenas of Ayurveda doctors. Usually, patient of chronic knee pain who have long-standing knee pain has three choices in front of them as treatment. Number one, gulp down painkillers for rest of their lives and suffer the consequences or side effects of that painkillers throughout. That is option number one. Take painkillers excessively for years together and suffer the side effects from them. Number two, go for knee replacement surgery. Number three, turn around to Ayurveda and give a wholesome approach not only to cure knee but also heal the whole body and strengthen all the joints as well. These are the three approaches in front of them, and it is not very surprising that they choose the third option. That is why people put immense trust in Ayurveda for treating the knee pain or any other joint pain. And it is important we know the intricacies of it and treat accordingly. Knee pain. This is told in Ayurveda and characterized under Sandhigata Vata. So, Lakshanas of knee pain are Vata Purna Dhriti Sparsham. That is, the joint of the knee is looking like a air-filled bag. And Vata Purna Dhriti Sparsham. Vata Purnam is also that, it is also referring that it is cold in touch. Vata Purna Dhriti Sparsham. Shofam, swelling. Shula, pain. Prasarana Akunchanayor Pravritti Savedana. While doing all the locomotor activities of the joint, the pain is increased. That is Sandhigata Vata. So there are three types of Sandhigata Vata. Even though this shloka generalizes the Sandhigata Vata, there are a lot to inside details and intricacies according to different doshas. So we can characterize Sandhigata Vata into three types. Basic dosha being Vata and Anubandhi of three doshas, Kapha Vata, Pitta Vata and Kevala Vata or Shaya. In this, there are these three conditions of Sandhigata Vata. We will discuss each one in detail. So let us discuss about Kapha Vataja type of Sandhigata Vata. Now, if you are someone who has no idea of treating knee pain according to the basis of dosha, or if you are in initial days of practice, I want to put your maximum concentration into this because this contains years together of experience and the knowledge that is learned from different gurus, which is a excellent working model for treating the knee pain. So, Kapha Vataja. How do you differentiate Kapha Vataja Sandhishula from rest of the knee pain? So, symptoms. You ask symptoms, stiffness will be present in knee joint. So, by mere stiffness, you cannot differentiate that it is because of Kapha or Vata. But most of the times, in Kapha, there will be always stiffness. Even in Amavata, there will be morning stiffness, etc. So, whenever Kapha is associated, stiffness will be present. So, even though stiffness will be present, what is the main differentiating factor between Kapha Vata and Kevala Vata is, see, if you ask the patient only two questions, tell the patient that there are only two types of knee pain increasing. See, just tell me if you are working excessively, if you are walking excessively, if you are climbing stairs, if you are using your knee excessively, pain is increasing, or you feel that you sit for a particular time and then you wake up suddenly knee pain starts increasing. Pain is increasing after taking rest or pain is increasing after doing activity. This is the major phenomenal symptom to ask for differentiation of doshas and getting a provisional diagnosis. So if it is of Kapha Vata, patient will tell, sir, I will sit for a particular time and then when I stand up, suddenly I feel throbbing pain in the knee. That is the excellent characterization and gives an excellent diagnosis of the patient is Kapha Vata. If the patient tell when I work excessively, when I climb stairs, when I walk too much, then the pain is increasing. Then the patient is definitely having Shaya or Kevalavata. So that is how you differentiate Kaphavata from Kevalavata. This is the main symptom to ask for. So to understand Kaphavata, how I will give an excellent example for understanding the Kaphavata. You have a dam. Okay. So all the gates of the dam are closed. There are a lot of water in dam on one side of the dam, but gates are closed. Because of the total gates getting closed, the other side of the dam has no water, has absolutely no water. Now, is there a scarcity of water? No. The other side of the dam has lot of water, but there is an obstruction in the middle. So this side of the dam do not have any water. So this is exactly the scenario of Kaphavata. For the other side to get water, you need to do two things. If you just open the doors of the gate of dam, automatically, because of the pressure barometer, from high pressure to low pressure, water gets transferred. So when you open the gates, water automatically flows to the other side where it is dry. Or when there is a rainfall, automatically the other side gets water. So there are two options to bring water to the other side. Either you open the gate or there is a rainfall. So similarly in Kaphavata, the patient is either fatty or well built. They may be well built also. The patient is having very good kapha. They are having very good nutrition in their body, but because of Amad Dhatu level, because of medius, or because of cholesterol, or because of lack of exercise and blood supply to the particular region, they are getting the knee pain. Because of an obstruction, because of Kaphavrita Vata, the nutrition is not reaching to the Sandhi joint. The nutrition that is available as a medius is not going and getting transferred as Poshana to Asti Dhatu. That is the problem in Kaphavrita Vata. So, crepitus may be present, bone degeneration may be present because of the kapha not reaching to the particular joint. Kapha, Shleshmaka kapha is the one that is giving nourishment to the joint. Because the Shleshmaka kapha does not reach that particular joint because of Dhatukata Ama, that is why the patient is having degeneration in the joint. So, if you closely examine, the Kaphavata Sandhishula is always associated with Ama Lakshanas as Ajirna Lakshanas. It will be either present with not getting proper digestion or feeling tired after taking food or constipation, etc. We have to see that as well. So let us come to the final part, that is treating Kaphavataja Sandhishula. See, making this video on knee pain, I made it extremely, I made it sure that I am extremely simple and I am understandable to even the first year students of BAMS. Why? Because if you are successfully able to treat knee pain effectively, many patients are ready to give their half of the property to you. Because that is the kind of amount of pain that they have to undergo for their knee in the old age. For a geriatric patient, not being able to walk or not having the chronic knee pain is the biggest headache for them. And any doctor who can cure them is God according to them. So, when I talk about treatment, please do concentrate if you do not know about this treatment. So, Kaphavata Sandhishula, we have multiple treatment options, multiple kashayas that can cure this condition, but each kashaya is unique and to be used in a particular patient. Now we have Rasna Saptakam Kashayam to treat, Rasna Dashamulam Kashayam, Varanadi Kashayam, Sahacharadi Kashayam, Gugulutikta Kashayam, Gugulutikta Gritam, etc. But where to use all these conditions, I will tell one by one. Rasna Saptakam is Ushna Ruksha Mutrala, and it is excellent in reducing Kaphavata and it is excellent in reducing pain instantly and swelling instantly. So Rasna Saptakam, whenever there is an acute pain and swelling, you can use Rasna Saptakam. Rasna Dashamulam, Whenever there is acute pain and swelling, but you need a little bala to the patient, then there is dashamola in it. Rasna dashamolam is kashayam is nothing but rasna yerandadi plus dashamolam. It is available in Vaidratnam company. So where you use Varanadi Kashayam, the patient is fat, the patient is having ama, the patient is having a lot of cholesterol, you seeing visible fat and the Dhatukota ama, both conditions you can use Varanadi Kashayam along with Kanchanar Guklu, etc. Sahacharadi Kashayam, very important Kashayam. Sahacharadi Kashayam is particularly used in the patient where they tell, sir, when I sit and I wake up, then pain is there. For such particular patient, you can mix Rasna Saptakam Kashayam plus Sahacharadi Kashayam. Sahacharadi Kashayam is specifically told for lower part of the body, is specifically told for knee pain, is specifically told for Adyavata, it is specifically told for Urustamba. It increases the blood supply to the particular part. Sahacharadi is a Sahacharadi is a first Kashayam that is told in Vata Vyadi Prakarana. Giving Rasna Saptakam plus Sahacharadi Kashayam gave beautiful result in lot of knee pain cases of Kapha Vataja origin. So you need to understand in detail what Sahacharadi. Sahacharadi is also Ushna Ruksha and it is Vatahara and it is excellent in reducing knee pain and giving the blood supply to the particular part. So where you use Guglu Tikta Kashayam? Guglu Tikta Kashayam, Tiktakam Asti Vardhanam, Ushna Snigdam, Guglu Tikta Ghritam and Guglu Tikta Kashayam is used as is the Ayurvedic calcium. Tiktakam, Maha Tiktakam, Ghritam, etc. Guglu Tikta Ghritam is the Ayurvedic calcium. Tikta is Ayurvedic calcium. Tikta is Asti Vardhanam. So, particular case where you need to reduce the crepitus of joint, in that cases you prescribe Guglu Tikta Grita or Guglu Tikta Kashaya. I prefer Grita than Kashaya. So, there are different types of Gugulu. Which Gugulu you choose? When in doubt, there is a life hack. Always choose Kaishar Gugulu. When in doubt, always choose Kaishar Guglu to the patient because it is a middle path. It does not increase any doshas. So when there is Shofa, choose Gokshura Guglu and Kanchanara Guglu according to the condition of the patient. The patient is as little Pitta, choose Gokshura. The patient does not have Pitta, is pure Kapha, choose Kanchanara. Yogaraja Guglu, Rasna Saptakam along with Yogaraja Guglu you can choose, but I do not choose Yogaraja Guglu because my desha, my place where I live in is Ushna and Yogaraja creates a lot of Ushna to the patient, whereas patients living in Bangalore, Shimla, Ooty, wherever there is a cold condition excessively, they can use Yogaraja Guglu and Maha Yogaraja Guglu, which is equally effective as well. Usually in all the colleges it is told that Gugulu first for Sandhivata you choose Yogaraja Guglu. It's not like that. I find other Guglus equally effective or much more effective than Yogaraja Guglus. That being said, Yogaraja Guglu is not less effective. It is used according to the condition of the patient. When the patient is having Ushnata, do not choose, please never choose Yogaraja Guglu, Varanadi, Kanchanara Guglu, etc. Always go from Gokshara Guglu, Kaishara Guglu, like that if you suspect Pitta in a patient. But otherwise you can use Yogaraja Guglu. It gives very good result if properly given in Kapha. So I always add calcium tablets. If I have Pravala Basmam, I give that is Asti Vardhanam, or the common calcium tablet I use are Riasto of Himalaya company or Albosang, any calcium tablet works fine. So coming to next, I told you these are all for removing the obstruction, removing the Kapha Vrita, but there is degeneration too. Other side of the dam that is dry. So there, that other side of the dam needs water. So Brahmana Chikitsa also should be given with, along with the Kaphara Chikitsa. You have to choose Thailam capsules or Ghritam capsules. You have 3 Thailam capsules and Ghritam capsules that you can choose. You can either choose Gandha Thailam, you can either choose Dhanvantram 101 drops, or you can choose Sahacharadi 101 according to the condition of the patient. If the patient is feeling that the blood supply is less, you can choose Rasana Saptakam, Gokshara Gugulu, and then you can prescribe Sahacharadi 101. Sir, I sit down and then when I wake up having pain, the ideal prescription should be Rasana Saptakam plus and then Gokshara Gugulu and Sahacharadi 101. The patient is having crepitus more, then you choose Gandha Thailam. their kadak sound is more like you on examination cryptus is more, their bone degeneration more. There you can choose Gandha Thailam. If you are in doubt, you can choose Dhanvantara 101, which is the middle path. Okay. And usually the prescription, after all prescribing all this, I prescribe some Dhanvantaram Gulika or Anuloma Churnam for if the patient has Ajirna, I will choose Dhanvantaram Gulika. If the patient has constipation, I will choose Anuloma DS or something. So ideal prescription contains one Kashaya, Rasana Saptakam Kashayam, Sahacharadi Kashayam, Rasana Dashambulam Kashayam, Varanadi Kashayam, Guglu Tikta Kashaya or Grita. Choose according to the condition. Guglu, Kaisar Guglu, Gokshur Guglu, Kanchana Guglu, Yogaraj Guglu. Choose according to the condition. Add any calcium if you want. Add Thailam capsule. Now, when adding Thailam capsule, you should be very sure that the patient does not have ama at the level of koshta. If ask the patient to show their tongue, if it has coating, if it has white coating, please do not prescribe Thailam capsule or Ghritam capsule. If they do not have that, if they have little amount of Jirna, then only prescribe Gandha Thailam, then you can prescribe Sahacharadi 101 or then you can prescribe Dhanvantram 101, Thailam drops, etc.